Another episode of A Closer Look. Thank you for joining us. Taking to Facebook this week, the head of Port Moresby General Hospital's Obstetrician and Gynecology Department, Professor Dr. GLEN MOLA, alluded to ongoing challenges in the hospital's maternity ward for staff and patients, highlighting stark realities like mothers delivering their babies on the hospital floor. The hospital's management's response to these concerns alluded to further concerns in the healthcare services provided by the nation's leading specialist hospital.
The Port Moresby General Hospital, located in Papua New Guinea's national capital, stands as the country's largest hospital, leading in specialist healthcare services. Hence, issues at its maternity ward, as flagged by Professor Dr. MOLA, turned heads in the country. Professor Dr. MOLA, in a Facebook post, stated that at Port Moresby General Hospital maternity, there are 10 to 30 patients whom we have provided healthcare for on the floor every day. In fact, in 2024, our records shows that over 7,000 women who came to Port Moresby General Hospital for life-saving supervised birthing services received at least part of their care on the floor, either in the admission area to the labor ward, in the birthing area itself, or in the postnatal ward. Senior medical officer with the ONG department highlighted that the hospital has one maternity ward and only 24 beds.
One labor ward, so at present that's not capable of looking after the current population that we're serving.
Professor Dr. MOLA noted the importance of healthcare service to women going into labor.
Get buggered ears or something in one day, but with pregnancy you can go from normal to dead in a matter of hours. And so a woman can progress from apparently admitting only needing primary care, and a few hours later she needs tertiary care because the placenta has separated inside, or she started to bleed, or the uterus ruptures, or something really bad happens. So she can go from someone apparently admitting with only the need for primary care to someone who is in danger of dying and needing tertiary care. So this is all the stuff that we have to consider when we're planning health services for mothers and babies.
Alluding to Port Moresby General Hospital's plans to become a Level 6 National Tertiary Referral Research and Teaching Hospital consistent with government policy, the head of ONG highlighted this.
Because we all have to get together on this one. You can't just have tertiary health services. That's like building a university without having any primary schools and secondary schools. I mean, who's going to go to university, for heaven's sake? It's a ridiculous situation, isn't it, to have a tertiary level something and no primary or secondary feed into it. And same thing in healthcare. You can't just have tertiary services and not have the quality primary and secondary care services that are designed to feed into those few people who end up needing tertiary level services.
Acknowledging the concerns raised, CEO for Port Moresby General Hospital, Dr. Paki Molumi, highlighted that the hospital currently is dealing with the challenge of providing primary and secondary health care for a rapidly growing population, not just in End City, but from the surrounding Gulf and Central provinces as well. He further noted that as a way to relieve Port Moresby General Hospital, the management and relevant authorities are looking at upgrading health facilities in End City to put in place referral systems to ease the overload situation at the General Hospital.
We've already started that process with the 6 Mile Clinic. Now you will know that 6 Mile Clinic is open 24 hours. It's an emergency arm of Port Moresby General Hospital. Thanks to the NCD-PHA theme. We are improving that facility, and we are hoping to have a modular labor ward in there with a postnatal care ward as well in there, and a modular operation theater in the immediate term, so that we can do deliveries there, as well as do abscess, fractures. What can be done at Port Moresby General Hospital can also be done at 6 Mile Clinic. So we are strengthening that facility to provide those services. We'll replicate that in other NCD clinics so that we can take off the load at Port Moresby General Hospital.
Adding to this, the NCD Provincial Health Authority acting CEO also noted the Metoria Health Facility.
And we also delivering babies there. So it's about 33 babies a month is being delivered at Metoria. So far, I think there's about 104 babies being delivered there. Now that's not much, but at least that's delivery outside of PMG that's happening in a public facility.
Dr. Oge also alluded to work currently underway at the Geru General Hospital.
There's a construction that's happening beside the facility. That's part of Geru as well. So it's in between the Geru police station and the emergency. That's going to be wards. It is anticipated that it will be complete by the end of this year. And that has 6 to 8 bed labor ward as well to deliver babies. So it's a 2-story sort of building there. It will have a pediatric ward and internal medicine ward and all that. It's not big, it's for a district level facility, but it will have those and a delivery as well.
With that, he highlighted that NCD is around 24 health facilities.
The Geru Hospital, which is designated level 5, but it's functionally level 4. Needs further investment in there to make it actually functionally level 5. We have 10 level 3 facilities and 12 level 2 facilities all throughout NCD. So that's a total of almost 24 health facilities.
He went on to note that the NCD-PHA is currently working alongside the Port Moresby General Hospital management.
We've been working very closely with Dr. Mulani because we serve the same patients. The same patients that come to us are the same patients that come to PMG. So the idea is that we focus, NCD-PHA focuses on the primary and secondary care so that we can relieve the burden here. Our major need is our infrastructure. Most of our clinics were built in the 1980s. Most of them have, need infrastructure rehabilitation so that we can meet the national health standards.
Commenting as well, PNG's Minister for Health, Elias Kapavore, said the health department is aware of the Port Moresby General Hospital's current dilemma.
The issues faced at PMGH have been ongoing for some time, and we are fully aware, and we are working closely with the respective PHAs, the CEOs and the board chairmen, and we have clear way forward. They've all completed their clinical services plans, their master plans, and the strategic plans for each of these PHAs. And I want to assure the public in the respective provinces that I am very positive with the support given by the Marape Rosso government that we will try our best to make sure that we deliver and improve the health services there. PMGH, as I speak, must be supported to deliver tertiary health care. They must be supported to deliver as a level 6 super specialist training teaching hospital. They must be now focused on providing health care in terms of heart, kidney, brain, and cancer facilities. And they are on track. And we are quite pleased with what the PMGH CEO and the management team at PMGH is doing.
Concerns are now further raised to provide essential health services in Central and Gulf provinces to ease the burden of the Port Moresby General Hospital and even other health facilities in the nation's capital, noting that people shouldn't have to travel so far out of their provinces to seek primary and secondary health care. Minister Kapavore noted an update for Central Province's Level 5 hospital.
Central Level 5 hospital, the clinical service plan, the master plan that is required to establish or to do the detailed design of the Level 5 hospital for Central Province was some delay, but now I want to say that it's completed and everything is set to commence the Level 5 hospital for Central Province. And what is now required is the Treasury. They have actually commenced their funding arrangements with the necessary loan arrangement to make sure that we secure funding for these health facilities.
It further noted that the health department are also aware of the rundown state of the Kerema Hospital and discussions are underway to address such.
I want to assure the people of Kerema that we will work together with Kerema PHA. I had a meeting with the Gulf Governor and the member for Kerema, and we will be working together closely with the leaders and the Gulf PHA to improve the health facilities there. We want to give hope and confidence to the people of Kerema that of Gulf, that we will be improving Kerema hospital. And we have established mechanisms. I'm aware that there's 15 million kina allocated that's been quarantined, and that will be used to improve some required or mandatory requirements for Kerema Hospital.
We now take a quick break, and when we return, we will look at the International Monetary Fund program in PNG.